Hello, a very good morning to one and all. I'm Dr. Shrutika. I welcome you all back to our new YouTube video today. Our we are into a series of views of Hahnemann on case taking. This video is the part 2. Part 1 is already uploaded. You can go and see that video and then you can come back to this video. So I have made a separate playlist of this, so you can find all the videos in sequence at one place. So let's get started with today's video. Okay, so going up ahead, we'll first revise what was the previous lecture about. So revision of previous lecture, which is already being uploaded. If you want, I'll pin down the link to you. So it was about aphorism number 83. So what was aphorism number 83? We'll just revise up in a gist. So this is individualizing examination of a case of disease, for which I shall only give in this place a general directions, of which the practitioner will bear in mind only what is applicable for each individual case, demands of the physician, nothing but. There are 4 important points that we need to keep in mind regarding to case taking. So that 4 important points are freedom from prejudice, sound senses, attention in observing, and fidelity in tracing the picture of disease. So we have talked about all the 4 points in a very detailed manner in the part 1. So kindly refer to part 1 and then we'll continue on to part 2. Now, going on to the next aphorism. Aphorism number 84 is about recording of symptoms. Now, what has been mentioned by Dr. Hahnemann in aphorism number 84 is what does he mean to say by recording of symptoms is the patient details the history of his suffering. Okay, the patient details the history of his suffering. Those about him tell what they heard him complain of, how he has behaved, and what they have noticed in him. The physician sees, hears, and remarks by his other senses what there is of an altered or unusual character about him. Now, whatever the patient's history he is giving, the history is about his suffering. It is given, the history is also given by what are the sources of history given by the patient. What are the sources of information we get from the patient is the first source is the patient himself, then the attendants, and then the whatever is the observation of the physician as a whole. So firstly the patient's history of suffering, then he'll tell about what the attendants heard the patient complaining of, then how he has behaved and what they have noticed in him, and then lastly would be the physician's own observation. Going up ahead, he writes down accurately all that the patient and his friends have told him in very expression used by them. इसमें कोई मैनिपुलेशन नहीं करना है. Whatever has been told by the patient or the relatives or friends who are accompanying with the patient, we have to try writing the same thing without changing the expression of the sentence or expression of the symptom that is given by the patient. So keeping silence himself, he allows them to say all they have to say and refrains from interrupting them unless they wander off to other matters. अगर हम कोई केस ले रहे हैं तो बीच में पेशेंट को बोल के क्वेश्चन पूछ के इंटरप्ट नहीं करना है. You have to let the patient talk whatever he has to tell you, or accompanying attendant जो उनको बताना है उनको पहले पूरा बताने देना है. And if they are going out of track, which is not something related to your case, and if the case is wandering here and there, so in that situation you have to interrupt, and unless and until otherwise, however it is going, you should keep silence. The physician advises them at the beginning of examination to speak slowly in order that he may take down in writing the important parts of what speaker says. Now this is very important. So पहले ही पेशेंट को बोलना है कि I am going to write your history in detail, so that you can make the points or jot down the points which are very important in your case taking, which will help you in prescription. So this aphorism number 84 में हमने क्या देखा कि sources of information क्या है, what the physician is expected to do and what not to do, And what is the instruction the physician should give to the patient before examination or before starting the case. Going up ahead, now we have aphorism number 84. Now we did aphorism number 84. Going up ahead, aphorism number 84 is every interruption breaks. Okay, so every interruption breaks the train of thoughts of narrators, and all they have said at first does not again occur to them in precisely the same manner after that. So अगर patient जब आपके सामने वो जो energy है ना, वो first energy के साथ जो भी आपको चीजें बोल रहा है, उसमें अगर आपने बीच में you tried interrupting, you tried asking some question to confirm your observation, तो वो link जो एक बार टूट गया ना, then after that the same thing will not happen again. So it is better not to break the link of the patient. Going up ahead is aphorism number 85. Now aphorism number 85 is about new symptoms, fresh line. So he begins a fresh line with every new circumstance mentioned by the patient or his friends, so that the symptoms shall be all arranged separately one below the other. So जो भी patient symptom बोल रहा है उसको one below the other in a very systematic manner we have to write, and each new symptom is to be written on new line. He can thus add to any of that may have been already related into a vague manner, but subsequently more explicitly explain. What does that mean? कि अगर आपने हर symptom को अलग अलग लिखा है, a new symptom is on given on fresh line. So आगे जाके केस टेकिंग में अगर पेशेंट ने कोई मोडालिटी दे दिया, कोई अम्यूलेटिंग एग्रेवेटिंग मोडालिटी दे दिया, कुछ वो पर्टिकुलर सिम्टम से रिलेटेड कोई और इंफॉर्मेशन दे दिया, so you can go back and mention those points into that same symptom instead of writing it on a new fresh line. So aphorism number 85 is about new symptoms on fresh line. Going up ahead, now we have aphorism number 86, that is physician's observation. This is very important. Aphorism number 86 is about physician's observation. When the narrator have finished what they would say of their own accord, the physician then reverts to each particular symptom and elicits more precise information respecting it in the following manner. He reads over the symptoms as they were related to him one by one, and about each of them he inquires for further particulars. तो एक बार पूरा पेशेंट का जो भी उसको सिम्टम्स हो रहा है, जो भी उसको बताना है, बता के होने के बाद the source of information can be from the patient, it can be from the attendant. तो सारी चीजें उनका खत्म होने के बाद we have to go back again to the first symptom and then we can inquire into the particulars कि अगर कोई किसी symptom का modality नहीं है, किसी symptom का हमें डिटेल में पूछना है कि बाबा क्या sensation है, क्या हो रहा है, कब होता है. So then we have to go after the patient has finished narrating. Going up ahead, what are the examples of this thing? So at what period did this symptom occur? What was it previous to taking the medicine he had hitherto been using? While taking the medicine, or only some days after leaving off the medicine? What is the kind of pain? What sensation exactly? Was it occurred on this spot? Where was the precise spot? Did the pain occur in fits or by itself at various times? Or was it continued without intermission? How did it last? At what time of the day or night, or in what position of the day it was worst or ceased entirely? What was the exact nature of this and that event of circumstance mentioned, described in plain words? So here the examples that we saw, if you will go through this, you'll understand that हर एक symptom जो patient ने बोला है उसके बाद जाके patient से पूछने की किस टाइप का पेन है, कब होता है, कहाँ पे होता है, वो क्या करने से बढ़ता है, क्या करने से कम होता है, so that we get a precise information and the exact nature or of the symptom. Going up ahead, next we have aphorism number 87. Aphorism number 87 is about details of symptoms. Now, and thus the physician obtains more precise information respecting each particular detail, but without ever framing his question so as to suggest the answer to the patient. मतलब क्या कि अगर इवन इफ वी आर ट्राइंग टू आस्क क्वेश्चन टू द पेशेंट टू गेट द पर्टिकुलर डिटेल, ऐसे क्वेश्चन नहीं पूछना है पेशेंट को जिसका आंसर यस या नो में दे दे, या फिर पेशेंट बोलते कि ऐसे होता है क्या, हाँ मतलब होता ही होगा डॉक्टर, ऐसे आंसर पेशेंट दे रहा है, ऐसे क्वेश्चन पूछना नहीं है. वी हैव टू क्वेश्चन, ओपन क्वेश्चन पूछना है, सो दैट ही गेट्स, वो अपने उसको जो हो रहा है ही कैन आंसर इट मोर प्रिसाइजली. ओके, so that he shall only have to answer yes or no, ऐसे नहीं क्वेश्चन पूछना है, और he will be misled to answer in this affirmative or negative something which is not true, half true, or not strictly correct, either from indolence or in order to please his interrogator, मतलब हमको, from which a false picture of disease and an unsuitable mode of treatment must result. तो पेशेंट यस या नो में, अच्छा डॉक्टर पूछ रहे हैं ना, तो ठीक है फिर मैं हाँ बोलता हूँ, नहीं बोलूंगा तो उनको बुरा लग जाएगा, ऐसे नहीं, ऐसे क्वेश्चन पूछना ही नहीं कि ताकि पेशेंट ऐसे आपको अफर्मेटिव या नेगेटिव आंसर्स दे. So, for instance, the physician should not ask, was not this or that circumstance present. ये मतलब आपको अगर एसिडिटी होती है तो एसिडिटी के साथ आपको नॉशिया वॉमिटिंग का फीलिंग भी होता है, ऐसे पूछना नहीं है. let it come from the patient. You, instead of asking the same question, you can frame it in this way कि whenever you are having the symptom of acidity, what are the accompanying, और क्या तकलीफ होती है उसके साथ, ऐसे नहीं पूछना है कि आपको नौशिया, अच्छा एसिडिटी उसके साथ नौशिया वॉमिटिंग होता है क्या. ओके, सो ही शुड नेवर बी गिल्टी ऑफ मेकिंग सच सजेशंस व्हिच टेंड टू seduce the patient in giving a false answer or false account of his symptoms. So going up ahead, next slide is about aphorism number 88, use of general expression. What is this use of general expression? If in this voluntary details, nothing has been mentioned respecting several parts or functions of the body or his mental state, वो mental state हो गया, it was a typing error, it is a mental state. The physician asks what more can be told in regard to these parts and these functions, or the state of his disposition of or mind, but in doing this he only makes use of general expressions in order that his informants may be obliged to answer into special details concerning them. So यहाँ पे एग्जाम्पल क्या है कि इफ यू वांट टू गो इनटू मोर डिटेल्स, अगर आप अपने को फिजिकल जनरल्स पूछना है, इफ यू वांट टू आस्क व्हाट इज द क्रेविंग, डिजायर, आपको मीठा पसंद है क्या, आप ज्यादा पानी पीते हो क्या, ऐसे हम नहीं पूछ सकते केस टेकिंग में. सो यू हैव टू आस्क एन ओपन एंडेड क्वेश्चन सो दैट द पेशेंट विल आंसर इट इन अ मोर प्रिसाइज फॉर्म, जो उसको उसका फिजिकल जनरल्स है वो करेक्ट बताएगा. या आपको ठंडी ज्यादा लगती है, आपको गर्मी ज्यादा लगती है, ऐसे नहीं पूछना है. सो for example, what was the character of his stool? How does he pass his water? How does it? How is it in his day and night? What is the state of his disposition, his humor, his memory? How about the thirst? What sort of taste has he in his mouth? What kind of food or drinks are most relished? What are most pungent to him? Has each its full natural taste or some other usual taste? How does he feel after eating or drinking? Has he anything to tell about the head, the limbs, or the abdomen? ओपन एंडेड क्वेश्चन पूछना है. सो अगर आप क्रेविंग या अवर्जन पूछ रहे हो, सो what kind of taste do you like, ऐसे ऑप्शन नहीं देना है. अच्छा आपको मीठा पसंद है, तीखा पसंद है, ऑयली पसंद, क्या पसंद है, ऐसे नहीं पूछना है. you have to ask an open ended question. So this was about aphorism number 88, that is use of general symptoms. Now going up ahead, next we have is aphorism number 89. What is given in aphorism number 89 is precise and special. So what is precise and special that Hahnemann has mentioned in aphorism number 89 is when the patient, for it is on him, we have chiefly to rely for a description of his sensation, except in the case of feigned pretend I am ill diseases. By has when the patient has by these details given on his own accord and in answer to inquiries, furnished the requisite information, and traced a tolerably perfect picture of the disease, the physician is now at liberty and obliged, if he feels he has not yet gained all the information he needs, to ask more special, more precise, more special question. So after you have already inquired about the particular symptoms, asked about physical journals, so अगर इसके बाद भी we have like something else to ask to confirm our remedy, so or any confirmatory question for the concerned remedy जो हम सोच रहे हैं या repeatization में आ रहा है, so then we can ask him more precise and more special question. Going up ahead, we have aphorism number 89. So aphorism number 89 के क्या examples है कि how often are his bowels moved, what is the exact character of the stool, did the whitish evacuation consist of mucus or feces, had he or had he not pains during the evacuation, what was their character, were there were they seated, what did the patient vomit, is the bad taste in the mouth putrid, bitter, sour, or what, before or after, during द रिपास्ट. सो यहाँ पे आप जो भी सिम्टम पेशेंट ने दिया है उसके डिटेल्स में जा रहे हो कि अच्छा वॉमिटिंग हो रहा है तो वॉमिटिंग किस प्रकार का हो रहा है, व्हाट इज द टेस्ट इन माउथ, देन यू आर इफ द पेशेंट इज नॉट बीइंग एबल टू टेल यू, देन यू आस्क कितना बिटर कैसे लग रहा है मुंह में, क्या टेस्ट आ रहा है, ऐसे. Going ahead, does the urine only become turbid on standing, or is it turbid when first discharged? What is the color of the first emitted urine? Of what color is the sediment? How does he behave during sleep? Does he whine, moan, talk, or cry out in sleep? So अगर आपने पूछा कि कैसे सोता है, अगर पेशेंट नहीं बता पा रहे, so then you have to ask, वाइन करता है, मून करता है, बातें करता है, रोता है स्लीप में, क्या करता है. How does he start during sleep? Does he snore during inspiration or expiration? Does he lie only on his back, or on which side? Does he cover himself well up, or he has not bare the clothes on him? Does he easily gets up awake, or he sleep too soundly? How often does this or that symptom occur? What is the cause that produces it time it occur? So ये जो special and precise questions आप पूछते हैं to get into more information to confirm our remedy. So we do that. Going up ahead, next we have another examples of the same more special and precise question आप कैसे पूछोगे. So when did the rigor come? अगर कोई fever का केस है अपने पास आया है तो आप कैसे पूछोगे, चिल स्टेज, हीट स्टेज, स्वेट स्टेज के बारे में कैसे पूछोगे पेशेंट को. So this is how it is mentioned in the guidelines which have been mentioned by Dr. Hahnemann is when did the rigor come on? Was it merely a chilly sensation, or was it actually cold at the same time? If so, in what parts? किधर ठंडी बजा था? How did it start? Where did it begin? सबसे पहले ठंडी किधर लगा? वो shivering उसमें हो रहा था क्या? Was he hot without the redness of face of हीट था, फीवर था, फेस रेड था क्या? What parts were hot to touch, or did he complain of heat without being hot to touch? How long did the chilliness last? How long the hot stage last? When did the thirst come on during the cold stage? During the heat, or previous to it, or subsequent to that? How great was the thirst, and what was the feverish desire? When did the sweat come on, at the beginning or at the end of the heat? Or how many hours after the heat, when asleep or when awake? How great was the sweat? Was it warm or cold, or on what parts? How did it smell? How does he complain on during or before the cold stage? What during the hot stage, after it, or what during and after the sweat stage? So ये सारी चीजें जो हैनिमन ने बताया है, Dr. Hahnemann has given it in aphorism in number 89 examples. So it is more precise question कि आपको questions कैसे पूछने हैं in whenever you're taking a case of the patient, and when the case is of fever. If whenever you're asking about sweat stage, fever के time पे thirst है तो कैसे पूछने का. So all this has been mentioned in aphorism number 89 examples. So going up ahead, we have aphorism number 90, that is observation. Observation मतलब क्या? Physician's own observation. So when the physician has finished writing down these particulars, then he makes a note of what he himself observes in the patient and ascertains how much of that was peculiar to the patient in his healthy state. So हम जो healthy state of and disease state के बारे में हम समझने की कोशिश करें. Once the whole case taking has been done and you are writing down more uh, your understanding or putting down your understanding. So observations कैसे लिखना है, how the patient behaved during the visit to your clinic, whether he was morose, quarrelsome, hasty, lachrymose, anxious, despairing or sad, hopeful or calm, whether he was in a drowsy state or in any way dull or comprehension, whether he spoke hoarsely or in low tone. मतलब जो body language है patient का, उसके ऊपर हम अगर उसके ऊपर हम कोई rubric लेते हैं, तो how it is to be interpreted. So whether he spoke hoarsely or in a low tone or incoherently, or how otherwise did he talk, what was the color of, on his face and eyes and of the skin generally, what degree of liveliness and power was there in his expression and eyes, what was the state of his tongue. So local, जब भी हम examination करते हैं तो we have to see the tongue of the patient, his breathing, the smell from the mouth, or his hearing, were his pupils dilated or contracted, how rapidly or to what extent did they alter in the dark or in the light, what was the character of the pulse, what was the condition of the abdomen, how moist or hot or how cold or dry was the skin to touch, whether he lay with head thrown back, with half mouth or wholly open, with the arms placed above the hand or on his back, or in what position. So what effort did he make to raise himself, or anything else in him that that may strike the physician, that may strike the physician uh, as being remarkable. So this was about aphorism number 90. What are the different observations of physicians? Now going up ahead, so yeah, so this whole presentation was all about that we learned into this was, firstly, let's summarize this thing. Summarize कर लेते कि आज की वीडियो में हमने क्या सीखा है. So it was, firstly we did revision of aphorism number 83, then aphorism number 84 में हमने देखा what is recording of symptoms, then what is aphorism number 85 is about new symptoms on fresh line. Aphorism number 85 के बाद 86 is about physician's observation. Aphorism number 87 is details of symptoms. Aphorism number 88 is use of general expression to ask the physical generals of the patient. Aphorism number 89 is about precise and special information. उसके examples देखे. And aphorism number 90 is about the observation of the physician. And that was it. We did into this part 2 of views of Hahnemann on case taking, his guidelines, which has been mentioned in 6th edition of Organon. So if you find this YouTube video useful, so do not forget to subscribe to my YouTube channel. And also if you have any queries, any questions, if you want to ask anything, if you want to suggest me anything, so you can post a comment or you can send a link to me, which is mentioned in the bio. So keep learning, keep sharing. Thank you and have a nice day. So yeah, this was it. So let's meet up in next video. So keep learning.